All right, let's dive into something a lot of you've been asking about. The UK's COSHH regulations.
The OSH, yeah.
You guys sent over some great resources from the Health and Safety Executive,
hmm
even excerpts from the actual legal document, the Control of Substances Hazardous to Health Regulations 2002. So for anyone who's not totally up to speed, COSH is all about protecting workers from, well, hazardous substances. But it gets kind of interesting when you see how they actually define hazardous. It's a lot more than just, the obvious stuff.
Right. It's not just like chemicals with a skull and crossbones on them. We're talking, dust, biological agents.
Oh, whoa, whoa. Back up. Biological agents.
Yeah, like bacteria and viruses,
Oh, wow.
even human endoparasites.
You mean, well.
Endoparasites. It highlights how, even things that seem pretty mundane, if they're not handled right, can be risky.
Like, even everyday things can have, like, long-term effects on your health.
Yeah.
It's not just about avoiding, the big obvious dangers. It's the everyday things that can sneak up on you. And that brings us to the employer's responsibilities. This is where things get, like, really interesting. COSH doesn't just tell employers what to do. It lays out a whole philosophy of risk management.
That's right. It moves away from just relying on, like, PPE as a last resort and focuses on eliminating or minimizing risks at the source.
So it's more proactive, not just like reacting to problems when they happen.
Exactly. Building safety into the entire workplace from the ground up. A key part of that is the requirement for a suitable and sufficient risk assessment.
Okay, so no cutting corners there.
Right. Employers can't just glance at a substance and call it a day.
Yeah.
They have to really evaluate how it's being used, what the exposure levels might be, what could happen, say, during maintenance or an unexpected event.
Thinking ahead, anticipating problems before they even happened.
Absolutely.
And that feeds into that whole hierarchy of control measures, right?
Yeah, you start with the most effective measures, like eliminating the hazardous substance altogether if you can. If not, you move down the hierarchy to substituting a less hazardous substance, engineering controls like ventilation. And then, finally, as a last resort, personal protective equipment.
So PPE is still important, but it's the last line of defense, not the first.
Right. It's like wearing a seatbelt in a car.
Yeah.
Essential, but you'd rather not have a crash in the first place.
Absolutely. I know the legal document itself can be a bit dense, but there's this section, Schedule 2A, that really jumped out at me. It's like a cheat sheet for employers, outlining 8 specific principles of good practice for controlling exposure.
It's a really good resource. It gets into the real nitty-gritty of, like, how to create a safe environment. One of the principles, for instance, emphasizes minimizing emissions and spread of hazardous substances right at the source.
So containment, like making sure the hazard is controlled right from the get-go.
That's it. It's not just about cleaning up spills or leaks. It's about stopping them before they even start.
Interesting. I never thought of it that way.
Another principle focuses on this idea of proportionality.
Okay.
Control measures have to actually match the level of risk.
Makes sense. You wouldn't need the same level of protection for something that's just a mild irritant as you would for, like, a highly toxic substance.
Right. But here's where it gets really interesting. One principle actually states that control measures should never increase the overall risk to health and safety.
Wait, how can a safety measure increase risk?
Well, think about it. Imagine you install a super powerful ventilation system to remove fumes.
Okay.
But it's so loud that it damages the worker's hearing, or it's so distracting that it leads to other accidents. The point is, every control measure needs to be carefully evaluated. Make sure it's not creating new hazards while it's trying to address existing ones.
So you got to think of the big picture. It's not just about Band-Aid solutions.
That's right. This all kind of leads to the question of what happens when things get really serious. We're talking about those highly hazardous substances, carcinogens, mutagens, and those biological agents we talked about before.
Right, because those are in a whole other category of risks. So what extra steps do employers need to take in those cases? We were talking about how COSH kind of steps up its game when you're dealing with the really nasty stuff.
Yeah.
The carcinogens, the mutagens, those biological agents that, like, sound like they're straight out of a sci-fi movie.
Right.
What kind of extra precautions are we talking about here?
Well, imagine you're dealing with something that, even with minimal exposure, could cause cancer years down the line. That's the level of seriousness we're talking about. Regulation 7 of COSH, it doesn't mess around.
No, half measures, huh?
One of the first things is this big emphasis on enclosing processes whenever possible.
Okay.
Creating a physical barrier between the worker and the hazard, to minimize the chances of accidental release or contact.
Like a safety bubble. Keeping all the dangerous stuff contained.
Exactly. And then there are strict rules about, eating, drinking, smoking in contaminated areas.
Right, because even a tiny amount of contamination could be really bad.
Exactly. And of course, there are specific procedures for handling, storing, and disposing of these really hazardous substances. It's all about managing the entire life cycle of that substance to prevent any accidental exposure or release into the environment.
Makes sense. Now, remember those biological agents we were talking about? They
Yes.
even get their own little chapter in the regulations, Schedule 3, if I remember correctly.
Schedule 3, that's right. It can get pretty intense. It outlines specific containment measures for different hazard groups, recognizing that, not all biological agents pose the same level of risk.
It's like a tiered system, with the most dangerous agents needing the most protection.
Yeah, think of it this way. A researcher working with, like, a harmless bacteria in a basic lab setting wouldn't need the same level of protection as someone handling, say, a deadly virus in a high containment facility.
Right, the level of precaution should match the potential consequences.
Exactly. And this brings us to those level 4 labs we mentioned earlier.
Yeah.
These are the ones that are designed to handle the most dangerous pathogens, the ones that could potentially cause, like, widespread outbreaks. The level of containment in these facilities is really mind-boggling.
I'm picturing something out of a movie with airtight doors, decontamination chambers, people in those full-body hazmat suits.
You're not far off.
Yeah.
One requirement for level 4 labs is they have to use airlocks for entry and exit. It's about creating that controlled buffer zone to prevent any accidental release into the surrounding environment.
Like a double door system, where one door has to be completely sealed before the other one can be open.
That's it. And it's not just airlocks. Workers in these labs often have to wear, like, full-body airtight suits with their own air supply.
Yeah.
And they have to shower before leaving the controlled area. All about preventing any contamination from escaping the lab.
Wow, no chances taken there. And remember those biohazard signs? The ones with the 3 interlocking circles? Well, those are mandatory in workplaces that handle biological agents. It's like this universal symbol of caution, instantly recognizable.
A visual reminder that you're dealing with something potentially dangerous.
Extra vigilance needed. But even with all these regulations and precautions, I bet there are still some surprises hidden within COSHH, like maybe requirements that catch even, seasoned safety professionals off guard.
Oh, absolutely. One that always stands out to me is the specific requirement for medical surveillance for certain substances and processes. Schedule 6 of the regulations actually lists these substances and processes,
Oh, okay.
and it highlights the need for, like, proactive health monitoring to catch any potential problems early on.
So it's not just about protecting workers in the moment, it's about monitoring their health over time to see if there are any long-term effects from that exposure.
Exactly. Taking that long-term view of worker health, recognizing that some hazards might not manifest immediately, but could have some serious consequences down the line.
Right. It's about prevention, not just reaction. And I'm guessing that ties into the whole, philosophy of COH, going beyond just simple compliance to actually creating a genuinely safe working environment.
Absolutely. Shifting the mindset from just avoiding penalties to really prioritizing the well-being of every worker.
And speaking of prioritizing well-being, I think it's important to remember that COHH isn't just about protecting workers, within their workplace. There are broader implications for public health and environmental protection too, right?
Absolutely. A lot of the substances that are regulated under COSHs can also pose risks to the wider community or even the environment if they're not handled and disposed of properly.
So it's about making sure that these hazardous substances don't escape the workplace and cause harm elsewhere.
Exactly. It's about recognizing that workplace safety is actually interconnected with broader environmental and public health concerns. Think about, say, a factory that uses hazardous chemicals in its production process. If those chemicals aren't properly contained or treated, they could end up polluting, say, the air or the water, potentially affecting nearby residents or even ecosystems.
Right, like what happens inside those factory walls can impact the health of the whole community.
Precisely. And that's why COSH is so important. It's not just about ticking boxes and avoiding fines. It's about creating that ripple effect of safety that extends beyond the workplace and contributes to a healthier environment for everyone.
I'm starting to see COSHH in a whole new light. It's a lot bigger than I initially realized.
Yep.
It's not just about compliance. It's about a broader commitment to ethical and responsible business practices.
And it's really interesting. COSH regulations have actually influenced safety practices far beyond the UK. A lot of other countries have adopted similar regulations, drawing inspiration from the UK's experience.
So AEHH is a bit of a trailblazer in the world of workplace safety.
Yeah, you could say that. It's a testament to the importance of these regulations and their impact on protecting workers around the globe.
This is all incredibly fascinating, but I feel like we're just scratching the surface. What else is there to uncover in the world of COHH?
Okay, so we've talked a lot about the philosophy behind COHH, the regulations themselves, even the global impact.
Yeah.
But now I want to get into some specifics. Like, let's talk about some actual hazardous substances.
Okay, sure.
Let's start with a classic.
Asbestos.
Yeah, asbestos. It's kind of like a cautionary tale, right?
Yeah.
Something that was once considered like this miracle material.
Right.
Now it's this notorious health hazard.
It really shows how, like, as our understanding of risks evolves, things change.
Totally. We were basically clueless about the dangers for years and years, and now we're stuck dealing with the consequences.
Asbestos was used everywhere, construction, other industries, but inhaling those fibers, it can lead to some serious diseases.
Like mesothelioma, right, exactly, a type of lung cancer that often doesn't even show up for years.
So even though asbestos is mostly banned now, it's still a risk in those older buildings, lurking behind walls and floorboards.
Oh, yeah. And that's where CPRH comes in. Any work that could disturb asbestos has to be managed super carefully.
Like, what kind of precautions are we talking about?
Specialized training for workers, controlled work areas, like negative pressure ventilation to stop those fibers from escaping, strict procedures for removing and disposing of the waste. It's a whole different level of care.
It's amazing how something so tiny, so seemingly harmless can be so dangerous.
Yeah.
Really makes you think about the long-term health of workers. It's not just about protecting them in the moment. It's about preventing those problems that might not show up for years, even decades.
Exactly.
Speaking of substances with long-term effects, what about lead?
Lead, oh yeah. Lead paint, lead pipes. It's been a problem for, like, forever.
Seems like it.
And while we've made a lot of progress in reducing lead exposure, it's still used in some industries, like battery manufacturing, some types of construction. COSHH requires employers to assess those risks and put measures in place to protect their workers.
Like what?
Well, think personal protective equipment, respirators, gloves, engineering controls to minimize those lead dust and fumes, and regular blood lead level monitoring to catch any early signs of exposure.
So again, it's that multifaceted approach, hitting the problem from all sides.
Exactly. Not just one solution. It's about layering those protections to create a truly safe environment. Okay, let's switch gears a bit.
Okay.
Let's talk about something that you might not think of as a hazardous substance right away.
Noise.
Noise. I mean, I get how it can be annoying, but hazardous.
Yeah, under COSHH, noise is recognized as a workplace hazard that can cause some real damage, specifically to hearing.
Oh.
Prolonged exposure to loud noises, like the kind you might get in a factory or on a construction site,
Yeah.
that can lead to permanent hearing loss. It's kind of sneaky, right? It's not like a chemical spill or a sharp object. It's just something we're so used to.
Exactly, but the damage can be just as real, just as debilitating. So COSHH requires employers to assess those noise levels and implement control measures.
So what does that look like in practice?
Well, it could be simple things like providing hearing protection, earplugs, earmuffs,
Right.
or it could be more complex solutions like using quieter equipment, putting in noise reduction measures in the workplace, maybe even redesigning work processes to minimize exposure to those loud noises.
It's interesting how COSH covers such a wide range of hazards, from the obvious stuff to the things you might not even think about.
Yeah.
Speaking of things you might not think about, I heard there are even regulations about vibration.
You're right. We often focus on those like big dramatic hazards, but something like, say, hand arm vibration from using power tools, that can have a really cumulative effect, lead to something called hand arm vibration syndrome, or HAVS.
Yeah, I've heard of that. It can cause like numbness, tingling, even pain in the hands and arms.
Exactly. And in severe cases, it can be really debilitating, making it tough to do even basic tasks.
Wow.
COSHH requires employers to assess those risks from vibration and take steps to protect their workers.
So how do you manage those risks?
Could be things like providing anti-vibration tools, limiting the time workers spend using that vibrating equipment, even like job rotation strategies to reduce the strain on anyone.
It's another example of that holistic approach, considering all potential hazards.
And it's not just about reacting to those existing hazards. It's about looking ahead, anticipating new challenges, embracing new technologies to, improve workplace workplace
What
safety.
kind of new technologies?
Well, for example, there are some really sophisticated software programs now that can help employers conduct those thorough risk assessments, track exposure levels, manage all that safety data more efficiently.
So technology is actually becoming a tool in the fight for safer workplaces.
Absolutely. And we're also seeing the development of new materials and processes that are just inherently safer, minimizing the need for hazardous substances altogether.
That's amazing. So it's like designing the hazards out of the system from the start.
Exactly. And as we wrap up our deep dive into COKH, I think it's really important to remember that these regulations aren't just about, like, checking boxes. They're about creating a culture of safety, where everyone feels like they can speak up about hazards and take steps to protect themselves and their colleagues.
It's about shifting that mindset from just avoiding fines to actually prioritizing well-being.
That's it. Recognizing that everyone deserves to go home safe and healthy at the end of the day.
Well, we hope our deep dive into CHH has given you some food for thought and maybe inspired you to learn more about workplace safety in your own world. Remember, knowledge is power, and when it comes to safety, that power can save lives.
Thanks for joining us. Stay curious, stay informed, and stay safe.